Hello again. I'm Braddock Supervisor John Cook. Welcome back to Braddock Neighborhood News, the program I am using to provide you with information on issues facing our community and ideas on how we can strengthen our neighborhoods. It's summertime, and although you may have momentarily escaped to the beach or your favorite vacation spot, here in Fairfax County, it's hot. The heat and humidity are usually both very high this time of year, which invites those little pests we all hate, mosquitoes. Mosquitoes and other insects can transmit disease, including Zika, and this month I invited Health Department physician Dr. David Wilder and Joshua Smith from the Disease Carrying Insects Program to tell us how they are working to help prevent mosquito-borne transmission here in Fairfax County. Dr. Wilder and Josh, thanks for coming on the show.
Thank you. It's nice to be here.
Let's talk about the health department. Dr. Wilder, just kind of tell us what your mission is at the county level as a county health department.
Well, our mission is mainly to protect the health of the community and to promote wellness for all the members of this community.
And as part of that effort, we talk about bugs because we have bugs here in the county. And Joshua, you deal with our disease carrying insect program. Tell folks what that's all about.
So we do a lot of surveillance in the county. We go out and we collect mosquitoes from a variety of locations around the county. We test them for different diseases like West Nile virus and Zika. We also do a lot of education in the community because there are a lot of things that people can do to try and help prevent mosquitoes around their home, but also to protect themselves from mosquito and tick bites.
And that's it's really important. We don't tend to do widespread spraying in the county, so we're going to have to live with the bugs. But there is a lot that we can do in our homes to keep them away from our yards. And it's important because of the diseases we're talking about. Dr. Wilder, Zika is something that I guess a year or two ago nobody had ever heard of, and now we're all thinking about it. So tell us what it is.
Well, Zika is a virus in the same family as yellow fever, dengue, and West Nile virus. It's transmitted mainly by mosquitoes, but can also be transmitted by sexual contact and also by blood transfusions. In most situations, it causes a very mild infection. Matter of fact, 80% of people who are infected with Zika have no symptoms of it. The other 20% mainly have fever, rash, joint pain, and red eye. But the major concern for Zika is that it can cause some very significant birth defects in the developing baby for pregnant women, and that's where our major concern is.
And tell us just a little bit about those birth defects and conditions so we know what we're talking about.
The one that we're most concerned with is called microcephaly. That's where the head and the brain of the unborn child does not develop fully, and even after birth it may continue not to develop as normal. There's also other brain and nervous system defects that can occur, and even a condition called Guillain-Barré syndrome, which is a paralysis that adults and others can get from it.
And since, as we've said, we're going to have mosquitoes in the county, if you're a pregnant woman, what should you worry about and what should you not worry about when it comes to Zika and mosquitoes in the county, and what should you do?
Well, right now, all the cases of Zika that we've had in the community are what we call travel associated. They're from people who've traveled to areas where there is ongoing transmission of Zika. Fortunately, we've not had that yet, although recently in Florida, they've been investigating, I believe, 4 cases now where it looks like there may be local transmission. But since we don't know when that could occur, we are recommending that all people, and especially pregnant women, try to avoid being bit by mosquitoes, and there's a number of ways that we can do that.
And what would be the things people should think about doing?
Well, the first is what we call vector abatement. It's trying to decrease the number of mosquitoes in the area. This can be done by source reduction, by going out and tipping and tossing the containers where these types of mosquitoes breed. Also, we can treat some of the water pools that can't be drained with a larvicide, and also in some instances we might do some adult spraying. Individually, people can do things like the proper wear of clothing, using insect repellents, and even looking at the time of day that they go outside. These are daytime biters, and there's certain times of the day where there's more hazard to people being bit from them.
Right. And just so we're kind of clear on that, right now in Fairfax, as far as we know, no mosquitoes that are carrying Zika, but there is the concern that I guess it's the Asian tiger mosquito that we think might be able to carry it.
Yes, and Josh, you might want to speak about our surveillance, our mosquito surveillance that we're doing.
Yeah, so as Dr. Wilder said, there is currently no evidence of Zika being circulated within our community, but we do have traps that we put up in all around the county. We have 71 locations where we collect mosquitoes on a weekly basis, and several of those locations we have a trap that's very good at collecting the Asian tiger mosquito, and we are able to test those mosquitoes at our health department lab. So just in case we did, so we do have that capacity to be able to test for Zika in our Asian tiger mosquitoes. But yeah, the things that people can do to try and help control mosquitoes around their home are things like source reduction, tipping and tossing any standing water. Those could be buckets, pails, kids' toys, a tarp that's covering something but might be collecting water, where it folds up. Just anything that could potentially hold water could be a good source of a good habitat for the Asian tiger mosquito. That mosquito is different from other mosquitoes in that it just lays its eggs and develops inside containers. So a big body of water like a pond, stormwater pond or something like that would not be a place where you'd find the Asian tiger mosquito.
That surprised me when I learned that they can breed in, what is it, like just even a couple tablespoons of water. So you really, when you talk about tipping and tossing, you need to be somewhat thorough.
Yeah, it's really important that you can get out at least once a week and check around your yard for any of those types of containers where those mosquitoes could be developing. It could be something as small as a bottle cap potentially. What we normally see when we go out to do an investigation or help people find out where their mosquito problems might be coming from, they're a little bit bigger than that, but it could be refuse in the yard, it could be buckets, like I said, kids' toys, tarps, the container, the saucer underneath a flower pot. If that's holding water, that can also be a good place for the mosquitoes to come from.
Those corrugated pipes.
Those corrugated
right?
pipes are really something that people may not think about very much, but can be an important source for mosquitoes. Because that water, if those pipes aren't draining properly, if it's not graded properly, they can hold quite a bit of water. And it provides a good place for the mosquitoes to develop, but not much else is going to be getting in there, and it takes a long time for the water to evaporate out of those.
All right. Now, while we don't have Zika circulating here, one disease we do have is West Nile. Why don't we talk a little bit about what that is?
Sure. So West Nile virus is a virus that, as Dr. Wilder mentioned, is related to Zika, but it's transmitted by a different type of mosquito, the Culex mosquito. And unlike Zika, which is transmitted back and forth between people and mosquitoes generally, West Nile has a cycle that involves another animal. So it normally goes back and forth between birds and mosquitoes, just certain types of birds, certain types of mosquitoes. But if a person gets infected, it's an accidental infection or an incidental infection. So the virus doesn't actually grow inside people. It's just kind of an accident that we would get infected. And about 80% of the people that get West Nile do not show any symptoms either.
When you say accidental infection, what's that mean? So it's not a mosquito bite, or it is, or what are we talking about?
So it's just that because we're not it's more of an incidental situation. So the mosquitoes that transmit West Nile normally are usually just biting birds. But sometimes they might bite a person if they can't find a bird.
But it is the mosquitoes passing
But
it
yeah,
directly,
it is the
but it's
mosquitoes.
just by accident. They meant to give it to a bird and they got us instead. So.
Yeah, and we don't have, and a person, if they were infected, the virus wouldn't grow very well in their body. So we would not be a part of that ongoing cycle of West Nile virus.
Dr. Well, tell us a little bit about medically about West Nile. We've heard a little bit, but a little more in depth.
Well, it's actually very similar to Zika. Has some of the same symptoms, the fever, rash, joint pain, but it also has some gastrointestinal symptoms like nausea and vomiting. Most people, though, recover completely from the illness, although they may have a period of time, weeks to several months, where they continue to have fatigue and weakness. Very rarely, some people can have some continuing problems with it, but mostly it's, it does run its course.
And that West Nile is relatively new here in the county. How did it get here?
Well, in 1999, West Nile virus was first identified in New York City, and that was the first time that ever had any evidence of it circulating in the Western Hemisphere. How it actually got there, we're still not really sure about that. But from that point, from the New York City area, over the next several years, it spread throughout the country, up and down the coast and all the way across the continental U.S.
And so how many cases do we tend to see in the county, doctor, in a given year?
I think last year we had about 8 cases of West Nile virus.
Right. So it's not prevalent, so that's good. But we do have a lot of mosquitoes. What are some of the other diseases that our mosquitoes are carrying in the county?
Currently, as far as we know, those are the only ones West Nile is the only one that's circulating here in the area. There are other diseases that could get, people traveling could end up, infected with another illness. Just like people might come back with Zika, they could come back with things like dengue or chikungunya or malaria even. And
then the one of the cousins, not scientifically, but of the mosquito is the tick, and so we know a little bit about Lyme disease, which we do have a lot of in the county. And doctor, tell us what Lyme disease is.
Well, again, Lyme disease is actually caused by a bacteria, and it has, again, some of the same symptoms that Zika and West Nile have, with the fever and headaches, muscle aches, even joint pains and stuff. But it also can cause some other conditions. Or if it's treated early on, it usually doesn't go beyond that. Although I will mention that the rash is quite different from the rash from the other two we've talked about. This one is called a bullseye rash, where you have a center of redness surrounded by a clear area and then a red ring around that, and that rash often expands. About 70–80% of people have that distinctive rash. If it's not treated, it can develop into some other more complications, including further joint problems, arthritis of the major joints. It can cause some heart problems and some neurological problems. But again, most people who are treated do recover from it.
And so what are the safety things that we tell people to do to avoid the tick bites?
Well, one of the things that they can do is just to avoid areas where ticks might be present. But if you're going out hiking in the woods, or you're going out golfing, but you end up spending a lot of time in the rough, you may want to take steps to prevent tick bites. It's a good idea to take steps to prevent tick bites. The good thing is the steps you take to prevent tick bites are also going to help prevent mosquito bites. But that would be wearing repellents, and you would want to wear a repellent that contains DEET, which is effective against both mosquitoes and ticks. Dress properly, which means long sleeves, long pants, light-colored clothes. Tuck your pants into your shirt and your shirt into your pants and your pants into your socks. The reason you do that for ticks is because ticks are going to be coming up from the ground, and it makes it harder for ticks to get onto your skin if you've tucked your shirt into your pants and your pants into your socks. You can also treat your clothes with permethrin, which is an insecticide. You'd want to do that before you wear the clothing, but permethrin-treated clothing is a great way to help prevent ticks from getting onto you, because as they crawl across the clothing, the permethrin, which is an insecticide, will actually kill them as they're walking on the clothes. And then for ticks, you always want to make sure that you do a thorough tick check at the end of the day.
What's a tick look like? And we don't have a picture here, but just if you're looking yourself over, what are you looking for?
So some of the smaller stages of the tick, so that is in the immature forms of the tick, the larval stage is one that often bites people. And they can be about I have a freckle here on my arm that I show people a lot of times, that some of the ticks can be about that size. So you might want to look for something about that big, the size of a freckle, but it's a freckle that's moving, or a new one that you never saw before, or one with legs. So if you get into the habit of doing a tick check regularly, you start to notice all those little spots you might have on your skin, and you know which ones might be a new one. The adult stages of the tick are a little bit bigger and usually more obvious to see, but it's the immature stages which are definitely a concern because they are so small and hard to see.
Okay. And you can do some things in your yard as well to have less ticks, as far as how you keep your grass and that kind of thing.
Correct, yes. One way to help minimize the number of ticks in your yard is to keep the grass cut short. Ticks like to live in areas with a lot of humidity, so if the grass is really tall or there's a lot of leaf litter, that provides some good hiding places for them down near the ground. So if the grass is cut short, then they just don't have very good hiding places, and it's not a good habitat for them. You could also do a permethrin or insecticide treatment around the perimeter of your yard if you knew you had problems with ticks. Just if you do have areas in your yard like that where ticks could be present, if you don't spend a lot of time there, you try and avoid those areas. If you've got a big yard, maybe you want to spend time in areas where you might have tall grass or a lot of leaf litter.
So, Dr. Wilder, we've been talking about the bugs. Are there other bugs that we should be concerned of, and just generally, what when you're studying diseases and studying insects and that kind of thing, what are the concerns that you're looking at?
Well, I guess I'd answer that by saying that we do ongoing medical surveillance constantly. It's usually what we call passive surveillance. It's reports that we get from doctors, from hospitals, and we have a team of epidemiologists who monitor these cases and try to see if there's any increase in that. And that could be anything from gastrointestinal outbreaks, foodborne outbreaks, or anything like that. And if we find something that we're concerned with, we go into what we call active surveillance, where we actively seek more information from individual physicians and healthcare providers and ask specific questions about the diseases that we might be concerned with.
In the county, we were following Ebola. We follow all the big bad things that are going on.
Yes, we do. And a lot of the routine things, like just different types of infectious diseases that do go around. One of the things we've seen a few times here in the last couple of years has been outbreaks of measles, or usually an individual case of measles, but something that we spend a lot of time and effort and resources in tracking down people who might have been exposed to that individual who has measles, so that we stop that, as measles is one of the most infectious diseases that we know. So that's one of the best examples of how we monitor for the diseases and do interventions to stop those transmissions.
And Josh, tell us, when you're monitoring bugs, what other insects are we looking at, and what are the concerns that we're looking at?
So pretty much, from a disease transmission standpoint, those are the two big ones, the mosquitoes and the ticks. There are a lot of other types of biting insects that you can find out there, but from a disease transmission standpoint, it's mosquitoes and ticks are our biggest concern.
And talk to us a little bit about why we do not do widespread spraying. That's something that some people will ask. They'll say, why don't we just spray and kill all the mosquitoes? And because we've seen in the past news reports of places that try to do that.
Yeah, so we use what's called an integrated management system, integrated vector management, integrated pest management system so some of the different things that we do, instead of just going out and doing widespread spraying all the time, would be we monitor our our vector populations. So we go out and we collect and we test them. And we also do a lot of education in the community to try and educate people about what they can do to help prevent mosquitoes around their homes, how they can prevent mosquito bites, and wearing repellents, dressing properly, all those types of things. We also do some larval surveillance and larval control. Adult spraying is something that could be used if the situation warranted it, but there are a lot of other things that we do to try and help, from a more holistic standpoint, to try and do a lot of different things to help, monitor and prevent these diseases.
There are some negatives associated with spraying. That is one reason we don't do them, as far as pesticides and that kind of thing.
There could be a time and a place where a pesticide treatment could be necessary, but any time that would be considered, it's with careful evaluation. There are, pesticides. The pesticides used to control adult mosquitoes are what are called broad spectrum pesticides, which means that they could impact other organisms as well. But if they're applied properly and they're applied in the correct way at the right place and the right time, then you should have minimal impacts on those non-targets.
Right, but as far as widespread spraying, we generally would not.
Yeah, that's not something we would normally do, correct.
Right. Now, let's say somebody's watching the show and a week or two, a month from now, they think maybe they're seeing some of the symptoms you guys have been talking about. What should they do?
Well, the first thing anyone should do when they have symptoms that they're concerned with is to seek care from their own healthcare provider, their own physician or other healthcare provider. And certainly with Zika, that's one of the things that we strongly recommend for people, especially those who are pregnant, that they immediately talk to their own physicians. These providers will contact us if they have questions about it, and most of them go through the health department to arrange for testing for Zika and several other things.
And seeking treatment, obviously, primarily because it's good for the patient, but it helps your office track what's going on in the county and to study any trends.
Yes, it does. And as a matter of fact, with the pregnant females, there's actually a national pregnancy registry, so that whenever we have a pregnant woman who tests positive for Zika infections, they're put into a national database where we can follow them throughout the pregnancy, and then actually follow the infant after the infant is born, at least through the first year, and possibly further, checking the development of that child to see if there's any potential effects from the Zika infection.
And because of Zika, are we recommending any travel restrictions on pregnant women, or are we recommending that any limits on contact with people who have traveled to certain areas?
Well, we do recommend, the CDC and World Health Organizations have recommended that people who are pregnant, women who are pregnant, that they should avoid travel to areas that do have the widespread transmission, such as most of Central and South America and the Caribbean, if they can, during that pregnancy, until the pregnancy is over.
And what's the recommendation for, let's say, woman's husband travels to South America on business? Any restrictions on coming back?
Well, in two ways. First, we tell people who've traveled to these affected areas that when they come back, they should try to avoid mosquito bites for at least 3 weeks if they have no symptoms. And that's so that we don't have, if they possibly are infected, even though they don't know it, that they don't transmit that infection to mosquitoes, which then could bite someone else. As far as contact, if they have a pregnant wife, pregnant partner, then the recommendation is that if they have no symptoms, that they avoid either abstain from sex or use a condom for 8 weeks afterwards. If the person should develop, a male should develop symptoms, then the recommendation is to actually use condoms or abstain for 6 months after those symptoms have occurred. And that's because the virus can stay longer in the semen than it does in the blood.
Okay. And Josh, as we're nearing the end of our time, any last minute thoughts for people about what they should just be doing on a regular basis around their homes to reduce the chances of catching any of these diseases?
Yeah, so really the most important thing that people can do is to check their yards at least once a week. It takes the mosquitoes a little over a week to develop in those containers. So checking your yard once a week, emptying out those containers, emptying that water out, tipping and tossing, storing those containers in places where they won't collect water, or just getting rid of them entirely. And also taking those steps to prevent mosquito bites, dressing properly, and wearing an approved repellent.
There we go. Stay healthy. I'd like to thank David and Joshua for joining me today. If you are looking for more information on mosquito-borne illnesses or any other health department issue, call their information line at 703-246-2411 or go online to fairfaxcounty.gov/HD. I hope you've enjoyed this segment of Braddock Neighborhood News. Thank you for watching. If you have any questions, comments, or other needs, please contact my office at 703-425-9300 or email braddock@fairfaxcounty.gov. Tune in for another edition, and please remember to look for ways to volunteer. Your community needs you.